When you think of plastic surgery, you think of maybe breast implants or even facelifts, but there's also this thing of getting rid of excess skin. So we're going to talk about that this morning, a couple popular procedures. Dr. Staci Hix-Hernandez with Scott & White, Round Rock, is joining us this morning. Thanks so much for being here.
Thank you for having me.
All right, and doctor, tell us about those couple of procedures.
Well, first, tummy tuck or abdominoplasty is a procedure where two things happen. First, the excess skin and fat are removed from the abdominal wall. Second, the weakened or sometimes separated abdominal muscles are plicated back in the midline, which tightens and reforms the overall contour and shape of the abdominal wall.
Okay, and who are potential candidates for this type of surgery?
The best candidates would be healthy non-smokers who are otherwise at a stable weight.
Okay, and what kind of, when you get clients, what's the typical story, of why they might need something like this?
The most common things we hear are women who have had pregnancies or maybe significant changes in their weight, and they've really lost that nice tone to their abdomen, and they're looking to improve that area.
Okay, and that's one of the surgeries you're talking about as far as getting rid of excess skin. And tell us about another popular surgery.
Another one we're seeing an increase in is an arm lift or brachioplasty. You can do a lot towards toning your arms at the gym, lifting weights, doing cardio, but you really can't address that excess skin and fat in this area without surgical removal.
And what do you tell folks they might have questions about? What's the best way to find a surgeon? What is your suggestion to them?
The most common way is talk to your friends, talk to other people that you know who have sought out plastic surgeons, and get on the internet, look around.
Okay. Any potential complications with these type of surgeries?
Oh, absolutely. We definitely want to evaluate our patients ahead of time to make sure that they don't have any comorbidities that would preclude them from anesthesia itself or that might impede their healing rates.
Sure, okay. And another thing, a lot of times I think folks want to ask a doctor, how many times have they done a procedure, right?
And that's actually very important. You want to make sure this isn't someone who's done one or two of these a year. You want to make certain that who you go to has a really good breadth of experience and does this with routine.
Okay. Now I have to ask you too, are these types of procedures increasing? Are you seeing more people coming in for things like this?
Absolutely, absolutely, because I think we're getting a better understanding of the limitations that we have improving these areas on our own. Diet and exercise goes a long way, but it doesn't improve everything.
Is there I know we talked about some complications or potential risks. Is there any type of person that really should not get one of these surgeries? Are they pretty all around safe?
They are safe. However, we do not recommend this in a smoker at all. Smoking just really knocks out our ability to heal, specifically at the skin level. These patients have a 22 times increased risk of having postoperative complications.
Okay. And Dr. Hix-Hernandez, you're with Scott & White, Round Rock. Is anything else you'd want to tell folks that if this is sparking an interest, what can they do?
Absolutely. The most important thing is if there's an area of your body that you're concerned with or that you'd like to improve, go speak with a plastic surgeon. Not every surgery is right for every patient. It depends on the anatomical problem that we're dealing with and your own personal goals. The only way to find out if you're a candidate is to go speak with someone.
All right. Well, doctor, that's all the time we have for this morning. Thanks so much for joining us. We appreciate your time.
Thank you very much.
All right.